You're listening to the Pharmacy Podcast Network.
Hello and welcome again to Occupation Station. I'm Diane Donato, and today our guest is a 1993 graduate, Dan Bosley. He is the owner of Keeseville Pharmacy Incorporated, and I think we have another innovator with us. We're going to get to that, though, a little bit later in this interview. First, Dan, let me welcome you to Occupation Station.
Thank you so much. It's my pleasure to be here.
Let's start out with this. As a student at ACPHS, how did you originally picture your career going?
Certainly not where it's at today. I knew I was going to pharmacy school at a fairly young age. I have some relatives who are pharmacists by the name of Dewey, and the oldest son, Mike, was a graduate, I believe, in 91, and his two other brothers weren't far behind him. Their father's a pharmacist, my uncle, also my godfather, so I knew that I was going to do it. But back in, the late 80s, early 90s, pharmacists were just those people in white jackets behind a counter who dispensed your medication. So it's really where I thought I'd be, and I thought I'd be in the traditional role, which was a community chain pharmacy somewhere in the North Country here in New York.
Tell us a little bit about being an independent pharmacist. What about that appeals to you?
Well, I think first and foremost, most of us who go into pharmacy anyway, I can't speak for other professions, but I think most of us who go into pharmacy go into it with the purpose of wanting to, knowing that we can have a positive impact on the healthcare of the people we serve. So when I looked at independent pharmacy, I had been moonlighting, if you will, when I was a chain pharmacist at a couple different independent pharmacies. And I just thought, you cut through all of the corporate red tape when you're an independent pharmacy owner because you are the corporate red tape. So that was really the appeal. Little did I know, 15 years in, that the payment models were all going to change and things were going to get really tough and financially tough. But still boils down to this day, the ability to provide quality, top-notch customer healthcare.
And you wouldn't want to do it any other way.
Correct. And I think this is now year, 21 for me, coming up shortly in a couple months of independent pharmacy ownership. Despite all the struggles, despite all of the crap that pharmacists and independent pharmacy owners go through, at the end of the day, it's knowing that my customers, my patients, can send a message after hours, can shoot me an email. If they're hospice or if they're friends, they can shoot me a text and know that I could provide that information or log into the store, meet them there on a Sunday, and get them the health care that they need without needing any permission or having to jump through hoops to do it.
That concern you have for your patients, for your customers, clearly must have been present with this innovation. I've really been looking forward to talking with you about this. You have come up with some wonderful enhancements to your pharmacies to add fresh foods and SNAP benefits. Can you tell us some more about that?
Sure, and I'd love to take credit for the idea in the innovation, but I will throw a plug out there right now if I can. There is a wonderful not-for-profit organization called ADK Action, who is a local community, like I said, not-for-profit, who approached me and said, look, little did I know at the time, this was back in 2017, so 5 years ago, little did I know that my store in Keeseville, and actually I have a second store as well. I have a store in Rouses Point, New York, Cornerstone Drug and Gift, and we're doing the same program there. Little did I know that both of my stores were not only in a food desert, but we're also in a pharmacy desert. This ADK Action approached me and said, hey, look, I know you used to have I was the owner of a Radio Shack franchise, which went defunct many, many years ago. And they said, what are you doing with that department? I'm like, I don't know, I'm just selling through it. So long and short, they said, would you like to do a daily farmer's market? And I said, my store in Keeseville is it's the traditional, when you think about a hometown, local, independently owned pharmacy, that's what it is. It's a small store, small footprint. And I said, I don't have room for 10 vendors or 12 vendors or whatever. And they said, no. What if we do some fundraising, and we get a couple coolers, and we figure out how we, get the local producers, growers to sell to you at wholesale. And we started, of course, like anything, you start with funky procedures, and it was clunky and awkward and weird, and we did consignment. But we now have, I don't know, probably 30 vendors, and I can tell you when you start to include the people who are farming, who are growing, repackaging, producing, slaughtering, freezing local grass-fed meats, making cheese, when you include them into your portfolio, you truly become part of the community. It's amazing.
And you made that happen, that partnership with the local farmers.
Absolutely, yeah. Without question, through the heavy lifting of ADK Action, we have made that happen. And we have some really big vendors who are local. Some of them grow and package. Some of them receive produce from, other local farmers and package. But all the way down to, we have our newest one is packages honey, has their own bees. And they're all within 15 miles of our store. And that's through, I don't want to mislead anybody, that's through May through November, here in the Northeast. When you get to the middle of October through April, May, you really don't have much for fresh greens and vegetables other than root vegetables. But we have plenty of squash, acorn squash, potatoes, onions, garlic through the season. And we do outsource through a couple regional. We've got a place out of Utica, New York that we source some of our produce through the winter, and we've got a national one as well. But our model has always been local first, regional second, state, and then national. But we strive for, I don't like to use the term organic, but locally grown, if you will, and not mass produced.
Do you have patients who are calling up the store to ask, not only is my prescription ready, but do you happen to have any milk in stock?
Absolutely. So, what a godsend through COVID. We actually had shut our doors for 3 months in 2020 when we couldn't get any cleaning or sanitizing supplies, and we didn't know what to do. It was the start of, a mess. And we shut our doors to walk-in traffic, and we just did delivery and curbside. And we actually were doing Google Sheets so people could get onto our website and they could see exactly what we had. We've kind of slipped away from that a little bit, but we still have people who come in and say, hey, are you getting your bread delivery today? Are you getting your wood-fired pizza delivery today? Or when are you getting it? Can we get on a list? And so, yes, they do ask that. And the goal really would be to, and I'm working on this at Cornerstone Drug right now. I'm in a national diabetic program trying to figure out how we can match good, local, fresh, quality food with dietary needs based on the fact that these people in this program will be diabetic.
This is just a fantastic story, Dan. I think it's just so innovative. I do have more questions for you, but we're going to take a quick moment for a message from ACPHS President Dr. Greg Dewey.
Hi, Greg Dewey. I'm the president of Albany College of Pharmacy and Health Sciences. Pharmacists, they can do so much more than they are doing. They are trained well beyond their practice. And it's become even more important because of the decline in our primary care. Roughly a third of our primary care physicians are going to retire. They're in their 60s, and they are not going to be replaced. And so who's going to replace them? It's going to be nurse practitioners, it's going to be physician assistants, and it's going to be pharmacists. And pharmacists have the training to do much, much more. It wasn't too many years ago, you would never dream of a pharmacist immunizing. And now it's second nature. But the world is getting complicated too, and pharmacists understand the complexity. If you go into a nursing home, chances are the average person could be on anywhere from 20 to 30 medications. If you just think about the complexity of that, just the process of figuring out which to take when is a daunting process. A doctor will take 1 semester of pharmacology in medical school. Pharmacists take 4 years. There's a lot going on. There's a lot of advances in science that are pushing the frontier. Pharmacists, I'm very big on the profession. I call it the central health science. There is nothing in the practice of medicine that doesn't involve pharmacy. So pharmacy is the central science, and we have to grow out from that.
Welcome back to Occupation Station. Our guest today, Dan Bosley. He's a 1993 graduate and the owner of a couple of pharmacies. Keeseville Pharmacy is, I think, where you are right now today, Dan?
I'm actually at home today. I was at Cornerstone Drug, my second store. Earlier today, I'll be at Keeseville on Wednesday, and I do share time between the two. And I didn't let you ask your question, but both stores are participating and are doing this. We call it the Pharmacy and Pharmacy 2, both with an F, local daily farmers market. Cornerstone actually just did theirs within the last year and a half through some really innovative grant funding from our local health department, from our local JCEO as well.
And that's part of the life of an independent pharmacist, I'm sure, which is a very busy life. What would you say is the future for independent pharmacies?
Well, I would say, or I would have to guess, that most people who are or will be listening to this call are pharmacists, are future pharmacists, are training pharmacists, are working with pharmacists, are some way involved with pharmacists. So they would know that over the course of the last year and a half, the life of a pharmacist has gotten to be very, very, very miserable, no matter where you work and no matter who you work for. Quotas are being installed. You've got to give this many COVID shots. Even if you don't have a quota, if you're working for some of my large chain competitors are offering Pfizer shots, Pfizer 11 to 17, Pfizer 5 to 10, Pfizer boosters, Moderna boosters, and they're all interchanged. And that doesn't take away the fact that we still have those patients who are getting pneumonia shots, who are getting shingles shots, who are getting flu shots. So the burden of pharmacists has been increased dramatically over the last year to year and a half. So I think the role for the independent pharmacy is so for me, we offer one set of shots. So when I do a COVID clinic, and I only do Moderna shots, and it happened to be with storage initially, and then it just got to be, it's not worth investing in a super cool freezer. And we had a state site locally that was giving a ton of Pfizer. So we'll do a Moderna clinic, and then we'll have our patients who have come in to say, hey, look, I need a pneumonia shot, or I need a Tdap, or I need a shingles shot. And we'll work them into that Moderna clinic and have their stuff kept in the pharmacy while I'm out in the vaccination room with the Moderna clinic. So we have no chance of mix up, no chance of, I'm sorry I gave you a Moderna shot, you were here for shingles. Just to kind of streamline it. So it makes it a little bit easier for my staff, but I think that's what independents we can set our own guidelines, our own structure, and I think that's really where we're headed. And any of us now can process prescriptions on a computer. I have technicians who now can do it better than I do, but it's what service can we provide? How do we think outside the box to do it? And I think that's where independent pharmacy is going. And I think if we can get a hold on pharmacy payers, and New York State is very, very, very close. We're waiting on some budget passing legislation right now. But if we can get a hold on that, there's no stopping independence. I mean, all pharmacists, or most pharmacists who aren't burnt out, care deeply about the people they serve. It's the reason we went into this profession. But when you can see light at the end of the tunnel and know you're making a difference, and know you can have a 10-minute conversation, know you can test somebody's A1C, which is a pilot program I'm in right now at Cornerstone, and have a conversation with them about their diabetes, or do a national diabetic program. There's just so many options. And again, it's not having to wade through all of the red tape and wait for a 3-week reply from corporate. And so I think if we are persistent, if independent pharmacy owners currently are persistent, there will be some longevity going forward.
And what advice would you give to current ACPHS students?
So I'm asked that frequently. I've done several Zooms for some professional organizations at ACPHS. I think there's several. Obviously, they have to work for somebody before they get licensed. They have to do an internship. They have to do an externship or rotations. Ask questions. Questions are free, and especially to pharmacists who, for all intents and purposes, we're the only healthcare professional who you can just walk in, ask a question, not pay a fee, and get an answer. So I think the same should come from students. Should be asking questions, You should be looking under every stone. There are a ton of opportunities, and you don't know when you're in school what you're going to end up doing. You think you know. I didn't think I was going to be an independent pharmacy owner, but I think you need to pursue every opportunity, every option, and see where it takes you. So asking questions would be the key.
Dan Bosley, 1993 graduate, thank you so much for your time today.
Thank you for having me.
For more information or to schedule a tour, visit acphs.edu. You can tune in to all of our informative stories at acphs.edu/podcast. Each podcast is also available on Apple Podcasts, Google Play, Stitcher, Spotify, and iHeart, giving you the opportunity to listen from a mobile device. Mark Occupation Station as a favorite, and you'll receive push notifications as soon as we publish something new. Occupation Station is also a proud member of the Pharmacy Podcast Network, the largest podcast content directory dedicated to the business and profession of pharmacy.